single visit dentistry or single visit crowns. So what is the advantage of it, and why should you consider single visit crowns? So when we prepare a teeth to receive a crown, there can be various reasons why we prepare a teeth to receive crowns. The tooth could be root canal treated so it can receive crowns, or the tooth can be sensitive, or it can have a decay that cannot be successfully restored with the filling so it can receive crowns, or alternatively for cosmetic reasons we can get crowns done. So whatever the reasons might be, when we prepare a tooth to receive a crown, especially a vital tooth, that is a non-root canal treated teeth, so it is exposed to the various conditions that are there in our mouth. It is exposed to the saliva, it is exposed to the food we eat, it is exposed by means of that, it is exposed to all the bacteria and the infection that is there in the mouth. So if less is the exposure to the outside environment, more successful will be the restorations which we do. So when we do a single visit crown, the time difference that is there between preparing the tooth and getting the crown is the least possible time. In about 45 minutes to an hour's time, you can get a crown done. So there is very little exposure that has happened. So in that meanwhile, in that intervening 45 minutes to an hour's time also, we can seal the teeth, we can protect the teeth from any contamination from bacteria. So the chances of success of the restoration is really, really long term. That is one reason. The second reason is, say, another reason where we can do is after a root canal treatment. So when you prepare a teeth after a root canal treatment and say that you don't get the crowns done immediately, so you wait for 3-4 days or a week's time, what typically happens is our teeth are very dynamic. Each of our tooth in our mouth moves on a daily basis, and this movement varies from time to time. Say morning it can move a little, afternoons it can vary, and of course evening time it can vary. So there is everyday movement that is happening, and also during the day itself the amount of movement of the tooth that can happen in the mouth varies. So when it varies, when we make a measurement of the tooth, so we capture the tooth in one specific position. So if you don't restore the tooth immediately, during this, because of this movement of the tooth that happens, there can be subtle changes that is happening which is not so significantly seen, but there can be a very minor changes which can affect the fit of the restoration. So if it affects the fit of the crowns, what can happen? It can lead to food impaction. An ill-fitting crown can lead to secondary decay post that. So all these can happen. So it's very important. So that's the reason we get that you consider single visit crowns. It's very important you to consider single visit crowns. So having said that, the next question would be, what can be done if it's not possible? Of course, considering single visit crown will be the first option. If at all it's not possible, always try to get a provisional crown done in the same visit. So what I mean by a provisional crown, say for some reason you are not able to get the crown in one visit. It's going to take more than 24 hours. It's going to take more than 2 days for you to get the crown. In that intervening time, to protect the tooth as well as prevent any tooth movement which is going to affect the fit of the crown, always get a provisional crown done. This is Dr. Arun from Pearls Dentistry, Chennai, Rajanamalapuram, running a dental centers since the year 2001. If you have not subscribed to our channel Pearls Dentistry, do subscribe. We're going to come out with more than 300 videos in the next 1 year. And if you have any questions, please do comment, do like and share the video. Thank you, Dr. Arun from Pearls Dentistry. Bye-bye.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.